And we can get started. Sophie, if you want to start sharing our PowerPoint, that would be amazing. So I guess just an introduction. Hi, I'm Jacqueline, and Angela and I are co-presidents of this UNC Asian Health Advocacy Alliance. I think my internet is unstable, so I'm so sorry if my audio is cutting in and out. But our mission is to improve the overall health of the AAPI community through advocacy, education, and community engagement, and help address the unique healthcare disparities the population experiences. We want to do so by acting as liaisons for the community, advocating for the community to take control of their own health, and also conduct educational work between the medical field and the community to better connect to yes, Hayden, that live stream is on to address the question. And I think we can go to Angela to introduce the
So once again, welcome everyone, both on YouTube and on this Zoom meeting, for coming and joining us today. We're very proud to present this COVID panel event where we're going to talk through and answer some questions about what the COVID vaccine is, how to get vaccinated, and hopefully answer some of your questions that you have. So we're going to break this event down into 3 main parts. The bulk of this event will be our panel discussion. We've invited 5 wonderful panelists and our moderator, Sophie, to give a small talk about going through some basic questions that we might, some people might ask. And then we're going to move on to the Q&A session, where we will ask questions that were presented in the chat, and also we'll have some time designated at the very end for people to unmute their mics and directly ask the panelists any questions that they may still have. Lastly, we will have a pamphlet distribution. This is a guide to get vaccinated, is what we called it. So it's just some fast facts about what you should expect during the vaccination, what are some places you can get vaccinated, and just a good pamphlet to have if you're interested in that. And some housekeeping things. Keep in mind that we are being recorded, so we can distribute this information in the future. So if you feel more comfortable asking your questions in the chat, we have that as well. In addition, we have translators for 3 different languages online today. We have Chinese, Korean, and Vietnamese. So we will, if any of the community members prefer to communicate in those languages, we are here for you. The translators will have their names and the whatever language that they can speak. So if you look at my name, it has Chinese under it, and Chinese characters next to my name. And lastly, we do plan to have to end this event at 9. However, we are very happy to answer any remaining questions, even if it's past 9. And one last thing, the recording in the future, if we don't have the language that you're most comfortable with, we will post a recording of this event afterwards with the subtitles that are translated to whatever language that is requested. Go on to the next slide.
Hello. Okay, so I can start introducing our moderator, Sophie. She's a PhD student at Gilling's School of Global Public Health. She'll be our moderator. She is a part of Gilling's Minority Student Caucus. She has conducted research on the relationship between media representation and the health of marginalized groups. last year, she moderated the Carolina Asian Center's panel on anti-Asian prejudice during the COVID-19 pandemic.
And introducing.
Our first.
Oh. Go ahead, sorry.
Angela, you can go ahead. You can take this.
Okay, so introducing our wonderful panelists. The first one is Caitlin. She is a PhD candidate in the Gilling School of Public Health. And she today will be representing the public health side of this conversation. A little bit more about her. She is currently doing research in global maternal health, health equity, and implementation science. She works at the Robin Martin's Global Health consulting firm, where her primary consultants are Kirk for Mothers, and she also works on a 500 million initiative to reduce maternal mortality. And currently she has 22 publications under her belt, and this includes topics of human rights and domestic responses to COVID. Our next panelist is Dr. Kim. He is a associate professor of medicine and pediatrics at the Division of Allergy and Immunology. In addition, he is the director for the UNC Allergy and Immunology Fellowship, Food Allergy Initiative, and the Allergy and Immunology Clinic. He has particular interest in medical education of all learners, and his goal is to recruit and train the next generation of leaders in the field of allergy and immunology with strong clinical training and productive research opportunities. Our next panelist is Dr. Lowerly. He is a George Barth Geller Distinguished Professor of Immunology, Surgery, and Associate Professor of the Pathology at Duke University. He works on identifying immune-based strategies for cancer treatment, specializing and utilizing the immune system to treat cancer associated with viral infections. Clinically, he focuses on surgical treatment for breast cancer, and as well as gene and immune-based therapy for breast, kidney, lung, colon, and pancreatic cancer. Currently, he's the co-founder of Replicate Bioscience, Inc. Next, we have Hyung. She is a policy advocate with the North Carolina Justice Center, and specifically under the Health Advocacy Project. She focuses on reducing harms from mass incarceration, injection of drug use, and opioid overdose through through service provisions, media, and policy initiatives, while coordinating with key stakeholders. She also works as the health journalist for NC Health News and holds several degrees from UNC Chapel Hill and other universities. And go on to the next, yes. And lastly is Elizabeth. She is currently serving as the director for clinic business operations for the UNC Healthcare. She has a background in speech and language pathology. And during the COVID era, she has taken up a leadership role in the UNC Friday Center vaccination site, which is the hub for vaccination in the Chapel Hill area. So we are very excited to welcome our 5 panelists. They cover perspectives of public health, medicine, research, and vaccine distribution, and justice. So once again, welcome everyone, and we'll move on into our discussion.
Awesome, thank you so much. I'm today's moderator. My name is Sophie. I'm super excited to be here, and I can't emphasize enough how grateful and happy I am to be able to support this organization. So like Angela said, today's panel is going to discuss sort of 4 big important topic areas about the COVID vaccine, starting with the public health importance of the vaccine. So sort of a big picture, public health perspective, and then going into how the vaccines are made, and then how the vaccine works once it's inside your body. And then lastly, how you can get your vaccine. And so the process of signing up, what you need to bring, and all that information. So without further ado, we'll kick this discussion off about vaccine public health importance with Caitlin Williams, our first panelist. Caitlin, did you want to say anything before diving into the Q&A?
No, just thank you so much for inviting me to participate. It's great to be here tonight. Good evening, annyeonghaseyo. So thrilled to be here. So let's get started.
Awesome. Okay. So the first big question here is, how are Asian Americans being affected socially and medically by COVID?
Yeah, so, I think given the news, the socially kind of mediated impact of COVID is pretty forefront in many of our minds. Of course, we've seen since the beginning of the pandemic kind of harm to Asian and Asian Pacific Islander owned businesses, with people being afraid that they might catch COVID in those businesses and not wanting to patronize them, particularly whether those are restaurants or nail salons or other kind of AAPI owned businesses. We've also, of course, seen a rise in anti-Asian discrimination and violence, ranging from kind of microaggressions up through physical violence. Some of the peak culmination of that, of course, being the attacks in Atlanta in March. But medically, there's also another whole piece of this, right? And, there's kind of exposure to the virus, particularly through work for people who are essential workers. And that's, everyone from healthcare providers to people who are working in nail salons, right? Because we have that whole gamut of different kinds of essential workers within our community. And we're also starting to see that there are some data to suggest that members of our community are less likely to be vaccinated than white Americans. We don't have really good data on this because often it's hard to get data on Asian American populations. Right, we're a really small, well, in many parts of the country, and when you look nationally, we're a very small part of the population. And so even in North Carolina, we often get lumped together kind of under this big other bracket. And so it's hard to get information. And we know that, for example, Chinese, Japanese, Korean people tend to have very different kinds of health outcomes and health and exposures to risks like COVID-19 infection, as opposed to other members of our community, like people who are Cambodian or Vietnamese, again, because of kind of class and labor distribution. So we expect that there are probably, if we were able to kind of pull back the surface of that data, that there are real disparities in our community and that there may be certain subpopulations of Asian Americans who are at really high risk of being exposed, getting sick, having poor outcomes if they get COVID, and having poor access to vaccines.
Thank you so much for touching on all those different dimensions that are affecting this, Caitlin. That's super helpful. So moving right along, the next question is, how is COVID-19 transmitted?
Yeah, so there's been, some debate about this for anybody who's been watching the really technical public health side of this, but the big picture answer is close contact with somebody who's infected, right? Whether that's that you're kind of sitting next to them in a restaurant, maybe you're, sharing an apartment, or spending, a prolonged period of time close to somebody who's infected. The other thing to know here is that an infected person can spread COVID-19 even before they know they're sick. So we know that once people are infected with COVID, sometimes they can give it to someone else a couple of days before they start to feel ill. This is why masks are so important, even if you don't feel sick. So to protect yourself, you want to make sure that you're waiting at least 6 feet or 2 meters away from other people, that you're wearing a mask that covers your nose and your mouth anytime you're with anyone who does not live with you. So I know oftentimes Asian Americans, we have a really broad conception of family, but we want to make sure that we're paying attention to who shares our household and we live with and are in contact with all the time versus the rest of our family or our close friends or our extended community. Anybody who doesn't live in the same house or apartment with you, you should be wearing a mask before you're in contact with them. And the last thing is that, you want to make sure that you wash your hands in high touch surfaces regularly. Now, there was a lot of question at the beginning of the pandemic about whether COVID-19 could be spread through something called fomite transmissions, this idea of surfaces. And there was a lot of, oh, make sure you bleach down your groceries before you open them and don't touch your packages when they come in the mail, right? That kind of stuff that we were really anxious about at the beginning of the pandemic. And the evidence that we have now suggests that that's probably not so much of a concern. Yes, the virus can survive for some period of time on surfaces, but being really cautious about washing your hands, not touching your face, washing your hands before you eat or prepare food, as you're kind of going in and out of places, and making sure to wipe down surfaces once a day is probably enough. We don't need to go through that whole scrub and bleach down everything constantly that we thought we did at the beginning of the pandemic. And the last point is that if you are going to gather with friends and family, and I know it's been a year, we're all ready to see each other, but if you do gather, especially now that it's warm out, gather outside in the fresh air. Air will be circulating and there's a much lower chance that someone will get infected.
Awesome. Yes. Thank you so much for that sort of brief but comprehensive rundown of what to do during COVID and safety measures. Yeah, right there. All right. Next question. What is the threshold for herd immunity?
Yeah, we're getting a lot of questions about this. And, the first thing that I want to say is we can only reach herd immunity if enough people get vaccinated, right? We've heard lots of things from countries saying, oh, let's just all go out and get COVID now, and then we don't have to worry about this. It has never once in the history of humanity happened that we have achieved herd immunity through natural transmission and infection. We only get there with a vaccine. So the best evidence that we have right now suggests that we need somewhere between 70 and 80% of people to be vaccinated to get to herd immunity. And the faster we get there, the better a chance we have of, stopping variants and making sure that the vaccines really are going to be effective for us. The good news about this is that the newest data that we have suggests that the vaccines reduce viral load fourfold, which can help reduce transmissions. This is a little technical. What it basically means is it's not just that if I get the vaccine, if someone who has COVID coughs on me, I won't get sick and need to go to the hospital. That's true. But it also seems like if I do get infected with COVID and become asymptomatic, because my body's immune system will be actively fighting off the virus, I'll have fewer virus particles circulating in my body, which means that I'm less infectious to other people around me. And this is really the piece of data that we're looking for the key piece to understand if these vaccines are going to help us kind of end the slow transmission and end the pandemic. And so the early data are suggesting that this does seem like it's going to be the case. So bottom line, we have to get vaccinated, and the faster we do this, the better, because we're in a race against the coronavirus. And the longer it takes us to get vaccinated, the more likely it is that there will be a variant generated, a mutation that arises that's able to kind of work around the vaccine. So getting to that 70 to 80% quickly is really important right now.
Absolutely. Yeah. And that brings us to a few more hard-hitting vaccine importance questions for Caitlin. So how can I trust a vaccine that came out so quickly?
Yeah, this is a real one. And I'll admit, when this first came out, was like, oh my goodness, I'm so glad that I'm not a healthcare provider and I don't have to be the first one, right? Let me just name that. But I think that there's 4 things at this point, now that we've been using these vaccines for some time, that we can count on. So the first is that even though it seems like these vaccines came out very quickly, and in many ways they did, all of these vaccines are built on decades of research from other coronaviruses, right? So SARS is caused by a coronavirus, MERS is caused by a coronavirus. There are lots of variants of the common cold that are caused by coronaviruses. So we've been researching coronaviruses for decades, right? This didn't just, even though SARS-CoV-2, the virus that causes COVID-19, appeared in December of 2019, we've been working on similar things for decades. And similarly, some of the vaccine technology that we're using in these, the RNA vaccine technology, has also been studied for decades. So the second piece of this is that these mRNA vaccines, which you might be hearing a lot about because this is kind of a new vaccine technology. We haven't used mRNA vaccines before, and I think some of the other panelists are going to get into more of the details of how these are different. But these are really safe because we never get the whole virus in our bodies. So we can't get infected. We can't infect other people. We don't have to worry about this with these vaccines. The third point is that even though these vaccines came out very quickly, they went through all the same safety checks, all the same clinical trial steps, all the same rigor as every other vaccine. The difference is that normally when you have your whole package of all of your information and you submit it to the FDA, you have to go wait at the end of the line. And the FDA will get around to reviewing your clinical trial data when they get to it, whenever they get to you in the line. Because we're in a moment of crisis, all of this regulatory information got moved right to the front of the line and went for immediate approval. So even though all the same evidence and the same kind of methodological rigor was there, it didn't have to kind of wait in line. So it had the same level of rigor in the approval, but we were able to get things out quicker. And the fourth and final piece is that at this point, millions of people all around the world have received these vaccines, and they've been shown to be safe. We continue to do monitoring to see if anybody has any kind of adverse effect, from a sore arm to fainting to blood clots, anything like that. We track that data. Blood clots have been getting a lot of play in the news lately because of what's going on in Europe with the AstraZeneca Oxford vaccine, which we actually don't yet have in the United States. But just for record, about 35 million people have at this point received the AstraZeneca vaccine. There have been 222 cases of blood clots and 18 deaths. We're still in the process of trying to figure out exactly whether those deaths are related and caused by the vaccine. But to put that in contrast, right, so that's 18 deaths, 222 cases versus, several million deaths already due to COVID-19. These are being really cautious. They're saying, the benefit far outweighs the risk. These vaccines are.
All right, and just really quickly, a couple more questions, and then we'll move right along to the next section. So how has the vaccine affected COVID rates so far?
In other parts of the country, we're actually not yet at a place where anybody who wants the vaccine can get it. So for us to be able to see COVID rates of COVID, possibly can, but lots of people are still exposed. And so because of that, we have to make sure that we all do our part to keep each other safe until everybody gets the vaccine, right? So we've got to wear our masks, respect social distancing, wash our hands, all the stuff we've been doing all year, right? As we start to get to kind of the right number that of people vaccinated, that we start to see transmission rates come down, then we're going to see that kind of that curve turn and the cases are going to come down. But it won't happen until we kind of hit a critical mass. We're exhausted. We've been doing this for a year. We've been sheltering at home, like enough is enough, but we're really, really close, and we just need to stick to it a couple months longer. It's important for us to keep flattening the curve so that hospitals do not become overwhelmed. This has been an issue throughout the pandemic. Certainly now, many of the, healthcare providers are exhausted. Let's just say that, right? We're all exhausted, but healthcare providers have been on the front lines and they're really exhausted. Many of them are quite burnt out. And in many hospitals, cases are high. Hospitals are stretched thin. There are places where, because cases are still rising, even though the vaccines are coming out, we're starting to see that, we're running out of oxygen tanks, or beds are starting to fill up. So it's really important for us to keep flattening the curves so these hospitals don't become overwhelmed. Again, we are really, really close to the finish line. So we've just got to all dig deep and try to just stick this out and keep doing what we've been doing a little bit longer until we can get everybody vaccinated.
Awesome, thank you so much. That was an amazing overview and a perfect segue into our next topic. Oh, and here's some of Caitlin's contact info if you want to reach Caitlin. So I'll leave this on for a couple seconds. All right, and then moving right along into our second panelist, as well as our second vaccine topic. And so Dr. Edwin Kim will answer some questions about the immunology of the vaccine, as well as how these vaccines are made, getting into some of the details of that. So we'll get started with Dr. Kim. Did you have any opening remarks before we dive right in?
No, just thankful to be here. I'm a Korean American. I've been here at Carolina now for 10 years and been in North Carolina for 15. And my parents and my brother still live up in New Jersey. And my parents in particular live in a very sort of Korean-centric area of New Jersey. So it's been fascinating to kind of hear their experience and then compare to what I'm experiencing over here in North Carolina, the good and the bad of those. So hopefully some of the information I can share will be helpful to folks. And here on this front page, my email is on there, very, very simple. But if any questions come up regarding sort of vaccine, immunology, allergic reactions to the vaccine, please feel free.
Thank you so much. All right, so we'll dive right in. So the first question is, if I am being safe or isolating, do I still need to get the vaccine?
Yeah, this is a wonderful question. And I actually get this in my clinic a good amount because we've had a lot of our older patients in our clinics who have successfully stayed home and avoided folks. And so this question has come up. And so what I would say is we clearly know masks and isolation work. It has been able to flatten the curve in many places. North Carolina is one of those places. And so it can decrease the likelihood of getting COVID-19. Unfortunately, it does nothing to help you if you do still get it. And so I think that's a critical message I give to our patients is that you can continue to stay isolated as long as possible, but if you happen to get it, that risk of severe disease is still going to be there. And so really vaccination is what you're going to need to protect yourself on that off chance, even in a perfect world where you could get exposed and get it. And then just like we heard in the first panelist with Caitlin, that broad vaccination, that is essential to getting us back to normal. That's how we get herd immunity and that's how we get back to normal. And I think that's the key message I try to get to folks.
Absolutely, yeah. I cannot wait to see my friends and extended family again.
Yep, I tried to give someone a hug. I mean, come on, it's been a year plus for a lot of us.
Absolutely, yeah. And so should I bother getting the vaccine if I got COVID already?
Yeah, so again, another fantastic question that comes up all the time. And sadly, now again, in North Carolina, I think if I recall, we're pushing very close to 1 million cases, which is just unbelievable for a single state. And of course, the numbers across the country are tremendous. So lots and lots and lots of people out there, unfortunately, have gotten COVID, and many have survived, although they may still have some sequela from that. And so this question has come up, and I think key points to know here is it's still a new disease and we don't know how long that natural protection lasts. We hope and wish it's something like chickenpox where you get it and you're protected for life. But right now the suspicion and my understanding is that's probably not the case, but we just don't know at this point. And unfortunately, there are a few case reports out there where people seemingly got it, recovered, had antibodies, and then got reinfected again. And so we're still trying to understand what in the world is going on here? How long does it last and how did those reinfections actually happen? And so we do absolutely recommend that everyone get that vaccine, even if you have had COVID before. The one caveat I'll put there you see here is the last bullet. There is a level of protection, especially in those first 90 days after getting COVID. So perhaps knowing that there's a limited supply, these are folks that maybe don't have to rush to the front. But if you have your opportunity to get it, and this will come up in a bullet down the road, a couple of slides from now, if you have that chance to get it, I would say just take advantage and get it.
Definitely, yeah. Thank you for bringing up all those different nuanced points. All right, so who is the vaccine safe for?
Great. So this is what I've been spending a lot of time recently, and I volunteered my services to David Wohl and some of the folks at the Friday Center, and they took full advantage. So I've been very involved in sort of developing some of the anaphylaxis guidelines, and then we've tried to put ourselves out, myself as well as my colleagues in allergy, to be open to consults around questions around vaccine safety, because there are just so many of them, and so much of it is leading to vaccine hesitancy. And so again, around allergies, I think we've gotten tremendous numbers of questions. Oh, I've had anaphylaxis to peanut, or I had a problem with the penicillin allergy, or latex gives me, hives, or all kinds of questions around different types of allergies and allergy type of reactions. And so the first thing I'm going to say to answer this is going to be, thankfully, really thankfully, severe allergic reactions, anaphylaxis. This is actually a very rare concern. Again, thankfully, there was so much attention on this when Pfizer first came out in the UK and they had those couple of cases in those first couple of days. My goodness, I mean, we all panicked because we thought this was supposed to be the answer and maybe we can't get it. That first look at the data from the CDC suggested up to 11 cases per million doses, which is still 11 out of a million is a very low number, but that was about 10 times what they were seeing for the flu. So still we were paying attention. As they've given more of these Pfizer vaccines out there, that number has steadily come down. So now we're at about 4.7 cases per million doses that are given. So again, a very, very rare event. The Moderna vaccine, even lower, 2.5 cases per million doses. And then for the newest J&J one, there's not great data that I've seen out there in the public just yet. If anyone else on the call knows, please share it. But what I would say is from the phase 3 study, they saw no episodes of anaphylaxis at all. Now, keep in mind, one of the reasons I think this allergy question has come up is because it's a new scientific technique, this mRNA vaccine. So people are like, whoa, what is this? We've not had vaccines like this. Perhaps it can cause some new problems like allergies. And in particular, these are the only vaccines that actually have this product called PEG. And so people were quick to try to blame PEG for this. But again, after all of these millions and millions of doses that are out there, I think we're quickly learning that PEG allergy probably exists. But I think the prevalence of this has been drastically overstated. And thankfully, it is a very, very, very rare thing that we're seeing. We are about to conduct a study here at UNC, as well as at other sites around the country, to try to actually understand what is the true risk of PEG allergy and these vaccines. So hopefully we'll be able to share official data around that with you all, as well as the general public in the next coming months. The final point I want to make here too is, and again, speaking to the presumed safety of that J&J vaccine, is folks who've had problems with the Pfizer or the Moderna, so gotten that first vaccine and had symptoms that might be questionable for allergies or even anaphylaxis, those patients are contraindicated, so they're not allowed to get the second dose of those. But we all consider them, including the CDC, consider them perfectly safe to get the J&J vaccine. So again, I think there is this thought that that should be safe. It doesn't have those same components that the Moderna or Pfizer vaccines have.
Awesome. Thank you so much for breaking that all down. I think this will complement the next panelist discussion about the various vaccines as well. So that's perfect.
Yep.
Ooh, it's not advancing. Okay. Okay, here we go. What long-term and short-term effects should I expect? What do these symptoms mean? And when should I start being concerned?
Sure. So again, getting at the safety of this. So I will say, and I'm sure folks who know other people who've got the vaccine can tell you, local shot reactions, meaning reactions where the injection actually went in, these are actually very common with all of the vaccines at this point. If you actually Google COVID arm, you're going to find all kinds of fun pictures around this. So it is a pretty common thing that at that site, people might get some redness, might get some swelling, it may feel warm and maybe sore. But what I can tell you is those are not reactions that typically progress to anything that's more serious or life-threatening or systemic. Truly is local to that site. Again, can be dramatic. So in some cases may cover up in almost the entire arm, but it is something that will go away without leading to any more scary stuff. At the same time, we've also heard of a lot of people who are having not what I would call allergy or anaphylaxis, but just this feeling of, I guess the term patients use is feel like they got hit by a truck. So this feeling of just really tired, really achy, this oftentimes is kicking in, usually not as much that same day, but possibly that next morning. And then for a lot of these patients, it may last, if they're lucky, a day, but some patients have had 2, 3, 4 days of this really icky kind of feeling. I wish there was a better word I could come up with. Again, these are thankfully not symptoms that are leading to scary, life-threatening hospitalization requiring types of reactions, but still are significant enough. And so that also, I think, has made some folks hesitant to get the vaccine. But again, I think the critical point here is going to be, actually, those are probably good signs. It's hard to believe that, but it's probably signs that your immune system actually saw the vaccine. It got in there, your immune system turned on like it's supposed to, and is responding to this. And by release of certain chemicals, it's probably causing some level of just basic inflammation or just activation. That is probably a good thing. Now, I do have to put one quick caveat in here, and in particular, this is going to be for Moderna and Pfizer, but maybe even for J&J, is that until you're fully vaccinated, meaning at least a couple weeks out from that two-shot regimen, that risk of infection is still going to be there. And unfortunately, at the hospital at UNC, and I'm guessing at other hospitals as well, we've had some situations where patients have symptoms 3-4 days after vaccination, fever, loss of taste, some of these classic COVID symptoms, and it was assumed that it was because of the vaccine. But it was actually COVID that they were probably exposed to just prior to getting vaccinated. And then they went ahead and exposed everyone else in the workplace without realizing it. So I think it is critical to keep in mind if you're getting any of these side effect symptoms, especially if you're getting sort of this fever symptom, it might be worthwhile to talk to your doctor and just clear it. Make sure that it is not COVID and it is what you would expect from the vaccine itself.
Absolutely, that's a super important caveat that you brought up. We super appreciate that. And yeah, I'm actually getting my second dose of Pfizer tomorrow, so I'm sort of blocking up the day after that to make sure I'm doing anything too strenuous. I know the second dose, especially, I've heard can be a little testy with feeling tired and stuff.
Yep.
But yeah, so moving right along, the next question is, can you be a carrier for COVID after being vaccinated?
So again, we saw that great data earlier that it does show that getting vaccinated seems to decrease that transmission of COVID. So hopefully, now again, I was trying to understand what this exact question was, but if it's talking about transmission, it does seem to suggest that vaccination reduces that. We are still learning more. And then again, as more and more variants pop out, these may change sort of this transmission risk. So I think it's critical that we continue to pay attention to this. And again, masking and distancing is still so important. And unfortunately, you've seen in the news and around North Carolina too, especially if you leave the triangle, people are getting loose. People want to get out there, want to get normal. And I think I worry that it might be too fast. So folks, just when you're in public spaces and around people that are unvaccinated or people you don't know, because you don't know if they're vaccinated and it's probably a little uncomfortable to ask them, you want to still do the masking, still do the distancing. I think it's critical. Now, again, trying to interpret what that question might have been, again, it's important to keep in mind the vaccine does not infect you. It doesn't give you the virus. So you can't spread that virus to the next person. And then some questions have come up about what happens with testing if you are vaccinated. And so critical is the viral type tests that are pretty common. Those should not be affected by this. But if you go and get an antibody-based test for COVID, that should be positive because that's what you want the vaccine to do, is to create those antibodies in your system.
Awesome, thank you so much. And then the very last question here is, if given the opportunity, should my family get vaccinated on the same day or should we stagger it?
Yeah, this one is an easy one for me. I would say absolutely yes. It's still so hard to get that vaccine. And so being choosy on it, I just think is asking for trouble, honestly. So if you can get everyone to get it, then great, go for it. And it's as simple as that. The staggering question has come up from mostly, for me at least, it's come up in the employment setting. So again, people may feel run down or just not functional for a couple of days. So I know some employers, UNC is no different, have suggested us staggering so that we don't have the entire unit going out for 2 days feeling icky. And so maybe in a home situation, some people may be thinking that, but I would just say if you can get it, absolutely go and get it. A small caveat here is going to be if you somehow suspect that you are at a higher risk for allergic reactions, it's possible that they may give you Benadryl. If you're having some mild symptoms there, that might make it hard to drive. So that might be a scenario that you just make sure you have someone you can phone a friend that might be able to drive you if you need to. But again, most important is we need to get as many people vaccinated as possible. If you get that chance, jump on it.
Awesome, thank you so much, Dr. Kim. And of course, we arrived at the same takeaway as from Caitlin's, get vaccinated if you can. And so this moves us right along to our next topic, as well as our next panelist, Dr. Lyerly. And so Dr. Lyerly will elaborate on the research side of things, how vaccines and specifically mRNA vaccines work. So Dr. Lyerly, any first initial thoughts before we go into the Q&A?
Yeah, thanks, Sophie. And again, it's been a terrific set of presentations and Q&A so far. I thought perhaps I might switch things a little bit and maybe make some introductory comments about these mRNA vaccines, maybe to address some of the questions that we had heard earlier about what type of technology is this and how is it different than conventional vaccines. And so what I pulled up some of the archives of publications we've had, and I just wanted to point out that this is an article published 23 years ago, and this was in a journal called Nature Biotechnology. And what it describes is the use of a messenger RNA loaded onto a cell of the body, a very important immune cell, and the modification of that cell with messenger RNA elicited an immune response. And this was a strategy that was employed in human trials for targeting cancer antigens. And it was considered an extremely safe strategy to make a vaccine. And the important feature was that the RNA had a very, very short half-life. It was very unstable. And so it disappeared from the body very quickly. And this was very important, for example, in using an RNA for a cancer gene. You definitely did not want to have that cancer gene persist or perhaps be integrated into your body or modify your genome in any way and so forth. So the fundamental premise of these RNA-based vaccines, as we heard earlier, the decades of use have been based on their fundamental safety and the absence of any ability to modify your genome at all. Let's move on to the next slide.
Awesome. Yeah. So this actually comes back to something that Dr. Kim had mentioned a little bit about the differences between the types of tests. So what are the differences between the RT-PCR and the rapid antigen test? And can we have the same level of confidence between both tests?
Well, the RT-PCR test is a test based on the amplification of these nucleic acids found in COVID infection. And so again, just as a primer for those of you who have not been into molecular biology or biology for a few years, you have to remember that the DNA is the genetic code. Coronaviruses are DNA-based viruses, and like humans, the genetic code is translated into RNA or messenger RNA, and then messenger RNA is translated into proteins, or the building blocks of the body, or the building blocks of this virus. And so DNA, what's phenomenal about DNA is that you can amplify this, and you can have very, very specific amplifications of DNA that allow you to detect exquisitely small amounts of DNA. So that's terrific and very specific and sensitive. But it does take a kind of an experimental process. You have to isolate the DNA and really run it in a laboratory. So it's not as quick, but it's certainly the state of the art. Now, proteins on the other side, they are present, and oftentimes they're present in enough abundance that rather than amplifying the presence of a protein, you might have an antibody that will bind to that protein. And that can often be a very quick test, right at the bedside, or a swab test that will give you information very, very rapidly. So the downside of the rapid test is that it's not as sensitive, and you may have a false sense of security if you have a negative test. Oftentimes the proteins can perhaps be not as specific with their antibody binding, and so there's also false positive tests. And so many people, again, would try to confirm any test with a genetic-based analysis, but of course, as we had mentioned, this may take some time. But again, as you can see here, that the flow of genetic information from DNA to RNA to proteins will also come into play as we look at the vaccine technologies. There are some DNA-based vaccines in which we genetically engineer viruses, and that's quite interesting. That's the adenoviral-based vaccines that J&J has. These are quite potent because the genetic information can be replicated and reproduced and so forth. The RNA-based vaccines, the Pfizer and the Moderna vaccines, we talked about how easy the messenger RNA degrades, and that's why it has to be stored at a very low temperature. It's packaged usually with some kind of lipid or PEG, and then it's injected once and sometimes injected a second time as a boost because you don't have the type of robust production of proteins that you would get with a viral-based vector or a DNA-based vector. So again, the test and the technology for the vaccine really use very fundamental knowledge that's, again, been used in biochemistry, molecular biology, and basically the emerging new medicines for the past 20 or 30 years really are foundationally the basis of these new vaccines.
Awesome. All right. And then our next question is, does the vaccine protect against multiple variants? I know Caitlin had talked earlier about, kind of alluded to different variants, and we now know that there are different ones. So yeah, does the vaccine protect against multiple variants?
Sure, that's a great question. And oftentimes when we think about variants, we think about mutations in the genetic code of the coronavirus. Obviously, there's genetic variation that can occur throughout the entire virus, but most people feel that the spike protein, which is how the virus enters the cell, on this cartoon, you see the coronavirus as a cartoon, perhaps entering into the airways, perhaps getting into the mucosa of your upper airway, or maybe even into your lungs. And these spikes are these spike proteins on the virus form the corona or crown that appears on an electron micrograph. But these spike proteins find a receptor on a human cell, and that receptor spike interaction allows the virus to enter the cell and go through its life cycle. It, oddly enough, acts very much like a parasite in that its life cycle requires it enters a cell for it to divide and reproduce and make, tons more virus. Now, if you can imagine an immune response in which an antibody binds to that spike protein, that virus won't, be able to enter that cell, and it can't divide, and basically will die because it can't reproduce. And so mutations that might cause variations in the spike that are different enough that antibodies don't continue to bind, but that maintain the ability to bind onto the receptor, that exquisite mutation that provides the advantage of entering the cell, but avoiding some of the antibodies produced. That's the cause that people are worried about these mutations. Now, fortunately, for many mutations, there is not a complete absence of binding, but perhaps a diminished binding of an antibody. And so if you do get a vaccine and you do get a boost, the probability of being infected with a variant is much, much less. So it's not so much that you have the great protection afforded by what we call the homologous vaccine, the vaccine directed exactly against the virus that you might see, but the heterologous vaccine that may be the cousin of the vaccine of the virus that you're going to be exposed to, it's still going to work, perhaps not as well. And again, it also points to the fact that we really want to encourage people to receive these vaccines, because they will have an antibody titer that is likely to provide a protection, and not only perhaps preventing against infection, which of course would be wonderful, but the idea that it would prevent the type of infection that would cause severe disease. I think everyone agrees that the reduction in disease severity is a major advantage of all of the vaccines. And again, the reason they do that is because they bind to the spike protein and not only prevent viral entry to a great degree, but they prevent the virus from reproducing and then going on and spreading beyond the initial infected cell.
Awesome. Thank you so much for that breakdown. All right. And then, is the vaccine more effective for certain ages or demographics?
Well, that's a great question. Clearly the all vaccines and all medicines are risk-benefit sort of calculation. And so what I've shown here in this cartoon is the antibodies that are surrounding the virus and that are preventing the virus from entering a cell by these antibodies binding the spike protein. Now, there are two things that we know about is that your ability to respond to a vaccine or to an infection is diminished as your body gets older. And so the people who are most at risk for severe infections tend to be older. Those people that have actually fewer side effects to these vaccines, and the experience I've had is that more older people don't have the kind of COVID arm or local reactions that all of you have and experience and so forth. And again, it may be related to the immune response. So certainly at this point, even though millions of people have been vaccinated, we don't really have the answer that would be sufficiently detailed to allow us to say, well, if you're Korean American, you should take the Moderna vaccine, or if you're if you're from the West Nile Valley, you should take the J&J vaccine and so forth. And I think I've heard the very consistent message, and I totally agree with that. From what we know now, if you have a vaccine that you have access to, and you don't have a specific indication, an allergy to a component or an allergy to a previous version of the vaccine, the best thing you can do is accept that vaccine. And again, and maybe in 3 years, 5 years, 10 years, we'll know perhaps in a more nuanced way, is there a certain patient population that is better served by one or another of these vaccines? We don't know that. And of course, special populations, the pregnant women, of course, that it's been recommended that they be offered this vaccine because the severity of disease for them is massive. Those people who are on immunosuppressive medications and so forth, they may not have the type of immune response that you might like to see, but certainly the mRNA vaccines don't have any capacity to replicate or to cause any harm. And so for those individuals who might feel that perhaps their immune system isn't sufficiently robust to protect themselves against some of these vaccines, again, that should be something they should discuss with their physician, but the mRNA vaccine certainly wouldn't be a replicating type of vaccine that would pose a threat to them.
Thank you so much. That's really, really helpful. And then we've got, this is a big one that I've heard a lot. Is one vaccine better than another? So between J&J, Pfizer, and Moderna, the three that we have here.
Yeah, it's a great question. It's certainly one that it'd be great to know the answer to that. But I would say that at this point, the studies that would be considered the gold standard to pick a winner, if you would be a comparator study for all of these products, and the outcomes of those studies include prevention of infection, prevention of severe disease, COVID-related deaths, and balancing that would be the side effects and so forth. So I think at this point, I think anybody that could tell you that one is better than the other, I would invite them to analyze my retirement savings and tell me what I should invest in, because they know a lot more than I do about the future. We just don't know right now, and nobody could really know. People will have opinions, but I again would encourage people that the vaccine that they can obtain in a reputable clinic would be really outstanding to get, and certainly I wouldn't hesitate to take any one of these that have received, in my understanding, emergency use authorization, not really FDA approval at this point. And we heard a little bit earlier about that, but there is a distinction, and that's why some of the safety data and the long-term consequences of these vaccines is still an important question for us to answer. I would encourage people, if they do participate in these vaccines, to perhaps consider participating in some of the clinical trials and clinical follow-up, because it would be certainly very important to have not only the general population, but ethnically diverse populations report on the types of potential side effects or consequences of these vaccines, so we'll know more and perhaps be able to answer this question.
Awesome. Thank you so much for that really, really candid and detailed answer. All right. So can you get COVID from the vaccine?
Well, it's not really possible. I brought this figure up because there is a vaccine that is available in the world, and it's from Sinovac, which is a Chinese produced vaccine, in which rather than using molecular biology techniques to isolate components of the vaccine, they actually chemically inactivate the coronavirus. And this inactivation process really kills the virus. And this is a vaccine technology that has existed for really, multiple decades. So killed virus vaccines, the disadvantage of making a killed virus vaccine is that you have to grow huge amounts of this virus and then kill it. And then of course, kill it at 99.9999% efficiency. Again, as we talked about, is it possible that one virus is not killed and you could get it? It would be theoretically possible, but I've never heard of this, and I think it would be impossible. So this is a very specific example. It's not even available in the U.S., but that's again the very most generous interpretation of this question. Could you get COVID from the vaccine? I would say the answer would be no.
Awesome, thank you. And then the last, just for the sake of time, the last two questions sort of go together. So if you could answer them, together, because they both have to do with timing. Sorry, my screen is sort of sticking. Here we go. So how soon do the effects of the vaccine kick in, and how long does immunity last from the vaccine?
Right, great question. I would say that the timing of the vaccine efficiency is really related to the process of vaccines and the vaccine's job to present antigen to your body's immune system. So the vaccine doesn't really provide the protection. The vaccine lights the candle that creates the flame that lights your body's immune system to produce the components that protect you against COVID-19. So in these cartoons, you can see that the process is in a killed virus vaccine, or if you have a Moderna or J&J vaccine that goes through an mRNA or an adenovirus, your body's immune system has to process this. And it's really a series of handoffs from specialized cells. The virus's components are processed by dendritic cells. They go to helper T cells. They get processed by B cells that make antibodies. And this entire process takes about a week really to get up to speed. The very, very efficient adenoviruses can do this quite quickly. The mRNA viruses, again, we talked about how labile they were, so they're a little bit slower and need a boost. But you're really going to have to wait 7 to 10 days after vaccine to really see the antibody titer that's going to be most protective. I think most people are saying that after a single shot of the mRNA vaccines, you might have 80% protection. After the second shot, you're going to get to 95%, and some of the adenoviruses are replicating or recombinant viral vaccines are going to go a little bit faster. I would encourage everybody to get their boost and to really protect themselves in that window of time when they are not fully protected, because the antibody titers aren't going to be strong enough to protect them. And again, we've heard what can happen. You definitely can get infected. I think Regeneron just has phase 3 data showing that rather than using antibodies that your body generates, you can get recombinant antibodies and get injected with these antibodies, and they can provide some protection to you if you happen to be clearly exposed to COVID-19, even after your vaccine, within that window that 2 to 10 days after your vaccine, or 0 to 10 days after your vaccine, in which you're not really protected. But again, at this point, we don't know how long the vaccines will work, whether it's going to be a yearly type of process. And so again, the jury is still out on that. But again, I think from all the technical details that I provided, and I apologize in advance for probably providing too much, there's no question that the bottom line message really is to get the vaccine, make sure you get the boost if you hadn't, and again, realize that it's really with the full vaccination that you're going to be protected against the more common variants, And if you get the boost and you really go and attend to the vaccines that you're getting, you're very likely to be protected, perhaps not from infection, but from severe disease against the variants as well.
Awesome. Thank you so much, Dr. Lyerly. And so with that, that brings us to the last segment of our session, which is how to take action, right? And so we have our two panelists, Dr. Hyun and Elizabeth Ramsey. And so they will talk about how to register, the process, what information you'll need, and other questions of that type. Yeah, so we'll go ahead and get started. I know we're a little bit short on time. I was supposed to keep time and I did not do a good job of it. So yeah, do you have any opening remarks before diving in?
Nope, we can go right through. Sophie, thanks.
Awesome. All right, sounds good. Okay, so first question here, what are some resources Asian Americans can access to help navigate this difficult time?
So I always like to uplift North Carolina Asian Americans Together. They always have some really great resources, and they often have really helpful webinars that are around very specific issues, whether it be mental health access or feeling connected during this time, and ways that the community can get involved in order to take some action, especially around some of the anti-Asian discrimination and violence that our community has been suffering.
Thank you so much. Yeah, that is helpful. And then you had a few slides with like these stats. Did you want to just quickly run through like some of these stats?
Just showing that, North Carolina is doing a really great job. We're seeing, more and more folks get vaccinated, but that's all. and the same for the next slide. It's a demographic slide. You can go to the next one if you want. And it's just showing how we're doing by race. And yeah, I just wanted to uplift what Caitlin said earlier, which is that, the data for Asian American communities is we're just all lumped up in one category. So that can really hide some of the disparities that exist within our community sometimes.
Awesome. Yeah, and these will all be on the recording if folks wanted to, pause it and take a look at it at a later time. But moving right along. So the important stuff, right? So what places in North Carolina can I easily get vaccinated?
Yeah, so the best resource, I think, is the website on from DHHS. If you could go to the next slide there. It is My Shot, My Spot. You can just type in your zip code and select, if you have a preference for what kind of vaccine you want, it'll find a location that has that specific vaccine in your area, and it'll take you through a really easy process on how to get signed up, and you should be able to make an appointment really quickly. And yes, it is free.
Yes, very important. It is free to everybody. All right, so next, do I need to have health insurance in order to get vaccinated? And does it cost anything to get vaccinated, which I think you might have just touched on?
Yeah, so it's 100% free and you don't need to have health insurance. There are no costs.
I do have a quick follow-up to that. So when I got my first vaccine, I was asked to present my health insurance. What happens if they ask you to present health insurance?
Just say that you don't have insurance and that the federal government is paying for it.
Perfect, thank you. All right. Yeah, and then any thoughts on this? Everyone gets a vaccine regardless of immigration status or ability to pay. Any other potential, things that they could ask?
They could ask, do you have an ID or your date of birth, things like that. Vaccine providers are not supposed to be asking for your ID, and that is not required. There might be some places that do it, and if they do, then you should, people should let community organizations know so that we can file a complaint with DHHS and let DHHS know that this is happening. So, but overall, folks should not be asked for ID. And I know that's what people are scared about. And you don't have to show proof of citizenship or legal immigration status.
Absolutely, yeah. And I think this is reiterated here. So is immigration status important to getting vaccinated? The answer is
nope, not at all.
Great. And then I think there's a resource here if you want to speak a little bit to this.
Yeah, so we have some resources available on the NC Justice Center website, and they're available in different Asian languages. So this is just an example of Vietnamese and Burmese, but for any folks who have relationships with people in those communities who have limited English proficiency and might have questions about their rights in terms of getting the vaccine, please share these resources.
Awesome. And then this one here for health questions about the vaccine.
Yeah, so I wanted to just share this website from California. Of course, California has a substantial Asian American population. I think something like 1 in 5 Asian Americans live in California. And so if you go to California's healthcare website, HHS website, they offer their information in 7 languages, whereas compared to North Carolina, it's only in English and Spanish. So, not only do they have Korean, but they also had Vietnamese, Mandarin, I mean, just, a lot. So I just wanted to offer this up to folks in case they were curious and finding, and wondering how they could find resources and information about the vaccine in a language that is more comfortable for them.
That is super helpful. I had no idea this sort of service existed. So thank you so much for pointing this out and uplifting this. And then next, who should I contact if I'm experiencing serious adverse effects?
911. So if you are feeling bad, like seriously having an allergic reaction, please call 911.
Yes, exactly. And I would say too, like at most vaccination sites, I think they make you wait for a little bit so that if you have the reaction right after vaccine, you'll be there so that people will be on duty to help take care of that. But yes, 911 if you're outside of the site and you're at home or something and need care. All right. Yeah. So when to call the doctor?
Yeah, so contact your doctor, healthcare provider if your side effects aren't going away and you're worrying about them after a few days. So that's the CDC guidance.
And lastly, the vaccine card. So is my vaccine card important and should I be keeping it safe?
Yes. Please keep your vaccine card. It's very important. Take photos of it. We don't know yet, what places are going to be requiring the COVID-19 vaccine for returning to normalcy, but we know that this is not a new thing. For example, school-age children have to get all sorts of vaccinations in order to enroll in public schools. University students have to get vaccinations. When you travel to certain countries, you have to get certain shots. So keep your COVID-19 vaccination record card. It will come in handy.
Yep, absolutely. Thank you so much for that, Dr. Hyun. And then lastly, we're going to turn it to Elizabeth Ramsey from the Friday Center. Elizabeth, thank you so much for being patient. I know you're the last one. And so I'm going to just let Elizabeth take over and talk about the process of getting vaccinated at the UNC Friday Center. And I know many people tuning in are probably around the Triangle area. So if you're near or in Chapel Hill, this could be especially helpful for you. So just let me know when I need to advance the slides, Elizabeth.
Yeah, you can go ahead and advance it. So we'd love to see all of you at the Friday Center. There are lots and lots of appointments available now that we've opened up to Group 5. So I can definitely connect with you offline after this if you're having trouble getting an appointment. This is a shot of the outside of the Friday Center. It's located on Highway 54 in Chapel Hill, just outside of campus. And it was the home of a continuing education center before COVID. They shut their doors and were closed until we knocked on their door and asked if we could host a mass vaccination site there. So we met with them on Christmas Eve and ended up opening the doors on January 11th. It's been open for about 3 months, and we've seen close to 75,000 shots, not quite that many patients, but 75,000 vaccinations at the Friday Center. So this is the main hub of vaccination at UNC Medical Center. There is another site at Hillsborough as well. You can go to the next slide. So this is UNC's website. It's similar to the state's website. It's www.yourshot.org. And there's a lot of information, lots of tips and FAQs, and but that blue button there, Get Vaccinated, will link you to an appointment website where there's a portal on a central phone line that's used across all UNC Health entity sites. And it's a central phone line that you can call to get an appointment. It's also there on the right on that sign. That's just a photo of a sign outside the clinic. And so you can schedule through either an online appointment or through a phone line. This is probably the worst part of the process, is getting an appointment. Once you get into the clinic, I think, things are pretty smooth, but it can be tricky to get in. I do say, I think, this week appointments have really opened up across the state. And so we're seeing those times dwindle to get access to the clinic. You can go to the next slide. This is a shot of the Friday Center from the back, kind of looking forward. We do some quick screening questions, make sure everybody's safe in the clinic. We actually do accept patient insurance if they have it, but we'll happily see uninsured patients as well. We bill the patient's insurance and for the administration of the vaccine, and the patient's not responsible for any portion of the bill. And you can go to the next slide. This is our primary vaccination room. The signs there designate the different shots that are available. We administer all three, and today we actually administered all three at the same time. And so it's now, the patient's choice. They can choose a 1-dose or 2-dose vaccine. If they choose a 2-dose, it's really either Moderna or Pfizer that's available that day. If it's a single dose, they know they're getting J&J and, are able to choose that if that's the vaccine that they want. You can go to the next slide. Yeah. These are just some photos to show, kind of how we queue patients and make sure that everything is really safe to ensure that the patient's getting the right vaccine on the second dose to get the same vaccine that they got on the first dose. Especially, administering, we administer about 2,000 vaccines a day and just shy of that. And so, with that many patients coming through, safety is a really big concern and a high priority for us. The whole process takes about anywhere from 20 minutes to an hour, depending on how many patients are there that day. So it's pretty quick. That includes the observation period. You can go to the next slide. I think it shows the observation room. Yeah, so this is just a big observation room. I think Dr. Kim mentioned in the chat that we observe every patient for 15 minutes, and that's just standard. If the patient has a history of anaphylaxis, we keep them for 30 minutes and watch them there. And really the main reason for that is because that's when the main reactions occur, is within that immediate period following injection. You can see there on the right too, for second dose patients, we go ahead and make a second appointment on site. So the patient leaves with their second appointment in hand, and they know the date, and are able to change that as well if they need to. And you can head to the next slide. This is just a shot of our med prep room. You can see the big fridge looking, that's actually the ultra low cool freezer there where the Pfizer vaccine is stored. And then beside it, the freezer and then a fridge to thaw vaccine. This is a shot that was taken before the room was transformed. There are actually about 4 more stations. So it's a really busy room manned by pharmacy at UNC. And you can keep going. I think I have one more. Yeah, so at UNC, you know, like the state, vaccinating all patient populations is really important across North Carolina. And so at the Friday Center, we've taken part in the state's effort to really give access to all patient populations. And so, you know, I think that, you know, if anybody has connections to minority populations, vulnerable patient populations, we do have direct access to online scheduling links. And we'd love to, you know, link patients up that are having a hard time accessing the clinic. So again, feel free to reach out to me and I can get you connected to those resources. So I think that's it. Thank you.
Yeah, thank you so much. That was really helpful, just walking through the process. And I am seeing in the chat that many folks have had good experiences with the Friday Center at getting in and out, getting their vaccine. So awesome resource. Thank you. All right, so that wraps up our panel discussion. Thank you so much to all the panelists. And then I will turn it over to the board members who are monitoring the chats to kick off the Q&A with those questions.
Thank you, Sophie. That was very informative. I learned so much. I'd like to thank all my panelists. I know we're running a little bit late, so if any of you have to leave, you're welcome to leave. Thank you so much for your time. We do have a couple questions from, you know, chat DMs. I will ask those first, and then after that, feel free, if you're in the call right now or if you're in the Zoom, YouTube recording, feel free to text in the chat box or raise your hand and I will allow you to unmute yourself and go ahead and ask your question. But we do have one question from the Zoom stream right now. What are experts' opinion on using plasma from recovered patients as a COVID cure? I will open it up to the panelists.
Dr. Lyerly, do you want to take that or I can jump on it? So again, I think it's just another one of those tools in our toolbox that I think folks are trying to consider for the treatment of people who are actively having COVID disease. But at this is, I think that's the question that you're asking. There continue to be clinical trials that are happening, just looking for additional treatments for it. But really, again, the essential piece, I think I am going to divert this question of is to never get there in the first place, to get everybody vaccinated so we just don't have to be dealing with that. Because I think there are some concerns. J&J's percentage efficacy is lower than this and that. At the end of the day, when you look at that severity, like the protection against severe disease, it's tremendous. All 3 of those vaccines are tremendous. And I think, again, that is going to be that essential way that we get through this and get better. Yes, they're going to be Regeneron and all these other types of treatments that are going to be out there. They'll continue to develop those. But at the end of the day, really the way to protect yourself is going to be those vaccines.
Thank you so much, Dr. Kim. I'd like to also point out Dr. Kim has been leaving some great notes in the chat. I've also transferred them over to the YouTube live stream. Take a look at those. He's added a lot of great information. I have one more question. This one probably be focused towards Caitlin. When will it be safe to travel again abroad? A lot of us have family members abroad and we are desperate to see them. So I think this is a pressing concern for a lot of us.
Yeah, absolutely. And I certainly have family abroad and I'm similarly, you know, family and colleagues, and I'm similarly itching to get, you know, back out to see folks. It's a little hard to put kind of a firm date on when it's going to be safe to travel again, because this is really dependent on a couple of things, right? So one piece of this is, of course, kind of access to vaccines and how many people are vaccinated in the places that you're traveling to. Globally, we see really, really big disparities in who has access to vaccine. So wealthy countries have snapped up all of the vaccine. I think I remember seeing a stat that Canada actually has enough vaccine stockpiled to vaccinate everybody 5 times over and still have some left. But the way that some of these contracts have been written with pharmaceutical companies actually prevent wealthy countries from turning around and giving those vaccine doses to low and middle income countries. Or to any other country. They have to keep them in their own country. And so there's a lot that we still don't know yet in terms of being able to kind of have have people in other countries get access to vaccines. Certainly I have family in Argentina and in Uruguay, and people there don't have access to the vaccines that we have here in the United States. The Sputnik vaccine was available for some time, and the Sinopharm vaccine has been available, but the other vaccines are not, and quantity is much more limited. So being able to travel is going to depend a lot on that. It's also going to depend a lot on what happens with these variants, right? I mean, we keep bringing this up, the idea that, there are these variants and we don't know how well the vaccines will work against them. But, as we have a global pandemic, right, a global crisis, this isn't something that just affects the US. As we see this kind of vaccine nationalism and the fact that we can't get vaccines in lots of other countries, we're more likely to see variants start to emerge in some of these other places where vaccines aren't available. So, I know we're all eager to travel. Certainly the travel industry is really eager to have us all traveling again, and has been, actively lobbying the CDC and the FDA to say, let Americans who are vaccinated travel without having to provide proof of a negative COVID test and things like that to try to get us back in the air. But I think it's going to be a while before we see travel kind of normalize again. Obviously, also individual countries are passing their own laws, right? Like New Zealand has really, really strict policies right now about who's allowed to travel there. We're probably going to see this continue for some time. Countries instituted travel bans really quickly. Or travel restrictions really quickly, even though many of them are, potentially in violation of international law. But we probably won't see that start to be reversed particularly quickly, although that may vary. Again, some countries are more dependent on tourism for their economic well-being. So we're starting to see those countries start to loosen travel restrictions. But I know that's not a very satisfying answer, but it's the most honest one I can give you right now.
Thank you so much, Caitlin. One more question. I'm going to direct this one to Dr. Lyerly. Will getting 2 vaccines increase immunity against COVID? For example, will getting Johnson & Johnson and Moderna increase your immunity? All right. Dr. Kim, would you be comfortable answering that question really quick?
I can try to jump in. Do you mind? I'm trying to understand the question though, meaning get both at the same time. I mean, I'm trying to understand what the question is actually asking.
Yeah, so I'm assuming that they're asking, would getting 2 separate vaccines at different times increase your immunity?
Gotcha. Yeah. So this is going to be that wimpy answer that we don't know. It's not been studied, but the way that these vaccines work and the boosters are supposed to work is that you get that first vaccine, your immune system sort of sees it, responds to it, creates protection, creates memory, and then that booster, the next one, actually turns on that memory and sort of builds on that and makes it stronger. And since all of the vaccines are targeting the spike protein that Dr. Lyerly had mentioned, I think there is the potential that getting, even if there are different vaccines, that they could build on each other, but very much not studied at this point. I will mention one sequence of this that is sort of being advertised now is going to be those folks who get 1 dose of Pfizer or Moderna and then have a reaction to it. Those folks are thought, again, to be able to get that Johnson & Johnson safely, and perhaps that gives them sort of an added boost there as well.
Thank you, Dr. Kim. We actually have another question for you about a comment that you made in the chat. You mentioned that we shouldn't post these vaccine cards on social media. So why is that? Can you elaborate upon that a little bit more?
Yeah, I mean, I think I personally have a concern, and I've seen it online too, that people can just counterfeit those and steal those for whatever things they want to do. And it may actually matter down the road. Again, right now, they're trying not to make those sort of things that people need to travel or do other stuff like that. But people like to share maybe too much online, and that's going to be a perfect example of something probably just not a good idea.
Great. And then we have one more question. I know that we have to wait 3 weeks after our first dose of the vaccine to get the second dose. Are there any negative side effects if we wait more than 3 weeks to receive the second dose?
Yeah, and I think that would build on sort of that concept from before. So you want to give it at least 3 weeks so that you sort of have that first initial kind of primed effect, and then you're going to boost on top of that. So too short definitely can affect the efficacy. Too long, less clear. You don't want to be going months and months and months and months, but a few weeks beyond that, I don't see any problems at all with that, because again, you're kind of boosting on that initial sort of memory that is in there. But yeah, I would think about it that way.
Thank you so much. And then we
Yep.
have one more public health related question. How is it possible that the coronavirus is continuing to mutate and make new variants?
Yeah. So this is really, this is a kind of interesting question, because coronaviruses actually, like in the scheme of viruses, mutate pretty slowly. Like the influenza virus, right? Like the common flu mutates really quickly in comparison to coronaviruses. Coronaviruses are pretty stable. The issue is that so many people are infected, right? We've got, each virus kind of has it, and Dr. Larley could speak to this much more precisely and eloquently than I can. But that each type of virus and each particular virus kind of has its own clock by which we expect to see it mutate as it replicates, right? We expect to see, so often that there will be a mutation based on however many copies of the virus are produced. And what happens when you have millions and millions of people being infected is that you're just kind of cycling through those replications that much more quickly, right? So, maybe it's a 1 in a million chance that you get just to say a number, right? A 1 in a million chance that you get a mutation. But if suddenly, 500 million people are infected, well, that's 500 mutations. And some of those mutations might matter for the contagiousness, or might matter for, how serious the illness is that you get. So these variants are really a function of the fact that so many people are infected. It's not that like, oh, the coronavirus has some super mutant thing. It's been, affected in a lab or something like that. I think, sometimes we hear these things and they can sound very alarming when we hear the word mutation, but this is really just a natural, in the same way, one of the ways I like to think about this is the same way that like me and my sister have like, most of our genetic material is the same, but we're a little bit different from each other, right? And the further you get out down the family tree, kind of the more distantly related we are. It's the same idea with some of these different variants of coronavirus, right? Kind of the more replications and the further out we get, the more that we start to see some variation and kind of natural mutations that can appear in recombinations. So this isn't anything to be like super alarmed about. Again, this is no like zombie mutant coronavirus, no need to worry about that. But just a matter of how many people have been infected. So again, not to like, beat the dead horse about vaccination too much, but the faster we can get folks vaccinated, the faster we can cut the chain of transmission, the fewer variants that we'll see.
Thank you so much, Caitlin. I have a quick question for Elizabeth. I was asked, when signing up to get vaccinated at the Friday Center, do I get to pick which vaccine I receive?
Yeah, so if you make an appointment through yourshot.org, you can choose a single dose and you'll know you're getting J&J, or you can choose a double dose, which will be either Moderna or Pfizer. I'll give you an inside tip. Typically, we administer Moderna at Hillsborough, and we administer mostly Pfizer, some Moderna at the Friday Center. So if you go to Hillsborough, you're very likely to get either Moderna or J&J now, but you'll know you're getting J&J by signing up for a single dose. And then if you sign up for a double dose, you'll get either Moderna or Pfizer.
Thank you so much, Elizabeth. I just have to say, I volunteer at the Friday Center, and I actually volunteered today. And Elizabeth is so hardworking. I see her running around all over the Friday Center all morning, and I'm tired. I'm just standing around, doing like basic volunteer tasks. I can't even imagine how it is like rounding up all those people every day.
We appreciate the volunteers.
All right, so those are all the questions we have from the chat. If anybody has any questions at all, please raise your hand and you can go ahead and unmute yourself.
Actually, can I make a comment? I'm sorry to, I guess I'm not supposed to. Well, anyways, I'm just thinking, again, it may be different here in North Carolina, but thinking back to where my parents are in New Jersey, and there are a lot of sort of the Korean communities that we know over there, first generation immigrants. Lots and lots of those folks have small businesses, and again, just language barrier and otherwise. And so a lot of them either don't have insurance or have very, very kind of not great insurance. And so unfortunately, what I see is a history amongst folks that I know over there of waiting to the last minute, basically to come in to get any kind of healthcare because of concerns for cost and all. And so I'm wondering sort of what is being done to sort of make that point that not only sort of the immigration status, but this is free. You don't have to have insurance and you can come on in and get it now. But is that message kind of getting out there in some way other than sort of on the internet? Again, I feel like there's lots of messages about like making sure there's sort of inclusivity, but the cost piece, I feel like I've not seen as much about.
I can just jump in from the public health standpoint. Like, I think that this is a real missed opportunity and we haven't done a good job of getting this message out. I think we've been so focused on just telling people to get the vaccine, get the vaccine, get the vaccine, that we kind of gloss over a lot of these other pieces. I know that I've tried to, in my own outreach to people, be really clear and say to them, like, hey, this vaccine is free. If anybody tries to charge you, that's illegal. You cannot be charged for this. This is free. The federal government is paying for it. Doesn't matter if you don't have insurance. But we have not done a good job of getting that message out. It's not been kind of one of our key talking points, and it probably should be.
I'll jump in too. I think to talk a little bit more about our outreach partnerships. I think that having a unique relationship with someone, helps for sure to get people that might be hesitant to get the vaccine in. And so, I think many of you probably have relationships, at least in this area, to reach out to people. So if you do, you can, become a community partner, and we can get you set up with direct links to be that bridge, to use, your own native language, and to really, reach those communities that might be hesitant because of cost or whatever other reasons. So yeah, we'd love to connect and help with that in the Chapel Hill and Triangle area.
I don't know if there's any other questions, but that is a really great segue into what we wanted to talk about. But please feel free, if I did cut you off, please put your message in the chat. I want to be able to get everyone situated. So let me share slides. We did create a document summarizing some of the things that we had addressed today. The link will be sent in the chat. Yes, thank you so much. And then we are working on getting those translated to as many different languages as possible for our link tree, where we will continuously update any sort of resource that we may have. And also, we are launching a health liaison service. If you're interested in that, please email our email right there. We are coordinating with language volunteers to try to help people access the vaccine and any other health care that you might need with someone who can speak your preferred language. So if you're interested in that, please email this email that we have up here, and we will get you coordinated and situated as soon as possible. And we will also put up the recording of this panel with the translated subtitles onto YouTube. We will be working on that very diligently and as soon as possible. It is like our fundamental mission to kind of do some of the things that Elizabeth was mentioning, right? To connect community members with the care that they need, and to kind of pull resources that we are so blessed to have with the university to help the community members. So with that, I just also want to say a huge thank you to our panelists for lending your time and your expertise with us. We greatly appreciate your contributions. We literally could not have done this without you. I try not to use that word very liberally, but I think that's a good use here. We'd also like to greatly thank our advisor, our members and especially the board and the advocacy committee for their hard work. They have done such, it was said in the chat, such a Herculean effort, and yeah, we really couldn't have done this without them either. And we'd also like to thank all other campus orgs that helped contribute to this panel and promote our success here tonight. What could not have happened without you guys. So with that, I just want to say thank you so much. And thank you to the panelists. And yeah, if there's any other questions, the board members will stay on, but we will be releasing all you guys. We realized this took a lot longer. Oh.
Yeah, we do apologize. It did go over a little over than we expected, but we will keep that in mind for next future events. And also we are on Instagram and Facebook to, if you guys want to follow our future events or any activities that we're going to put on, you can find us at UNC AHAA, HAAA, and then also our email. So once again, thank you so much for coming, everyone. Thank you again for the panelists for your time and your efforts. We do truly appreciate it. And we've been getting constant feedback saying this was so informative and everyone has learned so much, including myself and the rest of the board. So once again, thank you so much and have a wonderful evening and the rest of the week. And lastly, if there's any other remaining questions we can help answer as a board, feel free to ask.